And welcome once again to Living in the 21st Century. Joining me today is John Kelly from Second Thoughts and Anita Cameron, Not Dead Yet. John, it's a pleasure to have you on the show again. Tell me, what's the latest news on Second Thoughts and the assisted suicide bill here in Massachusetts?
Well, thank you very much, Errol. It's really great to be back with you. Just as a courtesy, my personal pronouns are he and him. And for people who appreciate visual descriptions, I'm an older white man with glasses lying on my side in bed with red sheets and a blue pillow and a window behind me. So, well, as you know, Errol, Second Thoughts Massachusetts, we're a group of disabled activists opposed to assisted suicide. And there's been a bill in the legislature. It's named S1384. And this is the same old bill we've been dealing with for years.
Yes.
And the Speaker of the House, Ron Mariano, refused to even bring up the bill. Proponents were making this big hullabaloo about a recent poll that supposedly showed 77% support for assisted suicide, but the question asked about ending people's suffering, which for a lot of people means physical pain.
Yes.
And as we always say, the proponents like to talk about physical pain, but when you look at why people support it and why they use it, it comes down to ableism, meaning that people can't stand becoming disabled, and because they've looked down on disabled people their whole lives, they feel like they've lost dignity when they become disabled. And so the bill's dead in the House, but we are worried about a court case now before the Supreme Judicial Court. That's the Supreme Court of Massachusetts,
Right.
which argues that there's a state constitutional right for assisted suicide.
Wow.
Anita, anything to add? Yeah.
Would you want to remind our viewers what's wrong with assisted suicide and how it really became a social justice issue?
Sure. Well, first of all, it targets disabled people, not because what motivates people is their disabling conditions. Like in Oregon, everything is about loss of autonomy, loss of abilities, feeling like a burden, being ashamed about incontinence. And then, people talk about choice, but when you come down to it, it's the insurer who has choice. They decide what treatment they fund and what they don't. And then another thing is that people will be put under pressure to use assisted suicide because of the systems that oppress people. Like there's no home care benefit. People are asked to do free labor, and with elder and disability abuse on the rise, we can't afford to allow people in their home with no witness to possibly be pushed or even coerced into assisted suicide. And then I'll pass to Anita on prognosis.
Yes. Yeah. Hi, Anita. Come on in.
Hi.
Hi. How are you today?
I'm doing good. Thank you.
That's great.
I was out yesterday actually at a function where we're trying to get the governor to pay our attendants $22.50 an hour, because here in New York we only get $15 an hour in most cases, and sometimes only $13 an hour. And so the access to to attendance, to home care and all is a really big factor. Let me back up. I'm Anita Cameron. I am Director of Minority Outreach for Not Dead Yet, which is a national disability rights organization that opposes assisted suicide, euthanasia, and medical disability discrimination in medicine. My pronouns are she, hers. And I am a Black woman with caramel colored skin, long locks, a pink shirt with Black lettering that says "Not Dead Yet, the Resistance." And behind me is an American flag where the field of stars are in the shape of someone in a wheelchair. And so, we think one of the things that the proponents, the laws are supposed to be for people who are terminal, which means they have 6 months or less to live, and mistakes happen all the time. Quite often, I mean, doctors can't really know. I tell the story of my mom, who was living in Washington State in 2009, right after they enacted their assisted suicide law. She was in stages of chronic obstructive pulmonary disease, and she was placed into hospice. She survived 6 months of hospice, but the doctors had her so convinced that she was dying that she opted to move home to Colorado to die. And so we made those arrangements for her to get from Washington State to Colorado, set her up in her own apartment with nursing care and attendant services. And my mom just basically waited to die. Except for 6 weeks later, she was in Washington, D.C., getting arrested with me, fighting for disability rights and justice. At that point, my mom decided, okay, I'm not dying. I'm going to live my life. And she lived for 12 more years. She passed away February 1st of 2021 of natural causes.
Yes.
But she lived to see all her grandkids, grow up, finish school, get married, have kids. And she lived her life. Had she succumbed to the doctor's kind of subtle pushing, we wouldn't have my mom anymore. And that's a scary, scary thing. Yes. But we're definitely blessed to have her for 12 more years. And that just goes to show you that, doctors can be wrong, and then when people get told that, it's natural to get depressed. It's like, oh my gosh, you just told me I'm going to die. Yet in these bills, there's no provisions for psychiatric treatment or anything like that. Some states have, the legislation has a clause in it where, okay, see somebody, but that person, the visits usually last 15 minutes to an hour, and the visits are only to determine if you have capacity to make the decision that you're making, not to treat any depression or anything like that.
John, do you believe that insurance companies have a diplomatic influence and presence in somewhat pushing for this assisted suicide bill so that they can hide or try to get away from paying out unnecessary expenses? What do you think?
Definitely. In a country without national health care, it's ridiculous to expect that people have equal access to medicine and insurance. And There have already been cases where patients have been denied coverage based on cost. Dr.
Yes.
Brian Callister from Nevada had two patients that needed expensive but life-saving surgery, and he was told by the insurers that his patients in Oregon and California, where assisted suicide was legal, that the only coverage could be hospice or assisted suicide, which is, of course, the cheapest option. Um, and then, um, and Anita, maybe you might want to talk about assisted suicide's impact on minority communities, especially Black and Latino.
Well, people say, and the studies show that um, the use of assisted suicide among Blacks and Latinos is very low, particularly among Blacks. Um, and there was a Pew Center research study that showed that Blacks and Latina communities are 65% against doctor assisted suicide. But Compassionate Choices has been making inroads into particularly the Black community, um, particularly the professional class folks. And so there is an organization of Black nurses that have come out in support of it. But laws like these put marginalized communities in danger. Um, the low usage of assisted suicide, particularly among Black folks, I feel is due to the fact that we have a healthy suspicion of medicine and doctors due to things that have happened to us, the experiments and whatnot that have gone on our bodies without our knowledge and consent. I'm sure people have heard of the infamous Tuskegee experiments where um, Black men in Tuskegee, Alabama, and surrounding areas were not treated for syphilis. The syphilis was just allowed to continue because the medical profession wanted to see what the end results of syphilis looked like. And so they let largely Black men suffer. And there's been other, experimentations, and there's so much racial disparities in healthcare that affect Black and Brown communities, particularly Blacks and Latino communities, that we have that healthy suspicion and that fear, and we know that. In particular, with Black folks, we're more likely to be written off as terminal anyway
Right.
by doctors. We are less likely to have our pain issues addressed, a situation that could lead to someone deciding that they want, the assisted suicide drugs. Um, as assisted suicide gets normalized around the country, because it's already in 10 states and the District of Columbia. But as it gets normalized around the country, I've been sounding the alarm that that Black and Brown communities, particularly Black and Latino communities, Indigenous communities, will suffer greatly because of the racial disparities in healthcare. Um, and with stuff like this, you can't concentrate, I think, if you will, on the present. You do have to look to, the future and see where these things are leading us. Because, like in the case of COVID has ravaged the Black community and the Indigenous community in particular, have ravaged our communities. We died have been hospitalized at much higher rates than whites. And with there was a push at one time to make COVID a precondition, if you will, for getting the assisted suicide drugs. Even though more and more people are surviving COVID, and with our communities being, so affected, we're really in danger, especially if you're disabled, if you're a senior, if you're sick, in other words, you have chronic illnesses and whatnot. We're in danger of doctor-assisted suicide, because certainly in the case of disabled people, unfortunately, if you are non-disabled, younger, you express suicidal ideations or thoughts of suicide, you will get help whether you want it or not, intervention. Yeah. Whereas disabled people, when we express that, it's kind of rationalized. It's like, oh, I see why you want to die. You're disabled. Nobody will want to live like that. And so we're helped to suicide rather than suicide prevention. Yeah.
I'm wondering too if that is really taking a national effect. I observe, and I speak subject to correction, that in most nursing homes where the elderly may be somewhat losing a little bit of their mind, you found that when they come into situations where they need resuscitation, you're saying, do not resuscitate. And I often ask myself the question, is this something that they themselves make up on their own, or if it was influenced by family members because they don't want the responsibility of taking care, or is it good for insurance purposes? All these are some of the questions I would have asked, but in my own consciousness, what do you think that is going on? Especially there also in Canada, there's lots going on with disabled people there. Could you expound a little bit on that?
Well, for many people with disabilities, they get a DNR put in their records, often without their knowledge or consent. And a lot of people find out by accident that they have a DNR on their records.
Yes.
And that's a lot of times because of doctors' own biases towards people with disabilities. And there was a 2021 Harvard study that showed, that like 79% of doctors see disabled people as having a poorer quality of life than non-disabled people. Like only 56% of those doctors would welcome a disabled patient into their practice. That 84% of these doctors are uncomfortable with the thought of dealing with a disabled patient. Yes. Now, in Canada, the situation in Canada, because Canada has assisted suicide and they have euthanasia on demand because of the Bill C-7, the situation in Canada for disabled people and poor people is dire, because in Canada, what's happening is that people with disabilities are choosing assisted suicide or even euthanasia because they lack access to services. So there was a woman named Sophia who had multiple chemicals sensitivities. And she tried for like 2 years to find safe housing with no smoke, with no chemicals, cleaning chemicals and the like. Her doctors tried to help her and everything. And when she couldn't find it, she applied for and was approved for assisted suicide. And so she did die by assisted suicide. There's been a couple of cases in Canada around people with multiple chemical sensitivities with a condition called Ehlers-Danlos syndrome. It's a condition that's you have hypermotility and you experience a lot of pain. Your joints pop out and whatnot. And there were a couple of women in Canada who could not get treatment for that condition, and they opted to die by suicide. There was a guy named Sean Taggart who had ALS, who could not get, he needed 24-hour care, could not get that. And so the option was to send him to a nursing home hours away from his home. But that nursing home didn't have the setups or the room for his computer system that would help him speak and control his environment. And so because of that, he opted to die. Okay. And I am seeing even, I'm noticing myself on Twitter, and I was actually involved in the case of a woman with disabilities in Canada who couldn't get treatment, or people who are disabled, but they're poor and can't afford to live while disabled, and they're choosing assisted suicide. And my fear is that as we keep expanding assisted suicide in the United States, that we're going to wind up in situations like these folks in Canada.
Okay. I want to ask John a question. Sorry for cutting you this shortly. John, would you think it makes sense then, while a person is young and full of energy, that they should have something stated early while their minds are intact, that don't matter whatever happened, I choose not to go the route as for assisted suicide? Would you think that would make sense in this time of season?
I think people can always make advance directives. Mm-hmm. They can set up a healthcare proxy. That's what I have. That's someone who could speak to your interests if you are in such a situation. Okay. And so when I was in the hospital in 2018 with life-threatening pneumonia, the doctor called my healthcare proxy and he said, no, treat him, give him everything to keep him alive. And he asked my brothers about my quality of life. And if they had not vouched for it, well, I might have been in danger.
Okay.
So, like the problem with Canada and what could come here is that I'm paralyzed below the shoulders, but I would be eligible for being euthanized like a dog.
That's awful.
In Canada because of the so-called poor quality of life, and that's just straight up ableism.
Absolutely. Anita, one question, we are getting down on time. I heard you on Pushback Podcast, the erasure of Black disabled voices. What is your message to the Black community?
So my message to the Black community is we are rife with ableism in our community, and we need to examine ourselves. I'm all about Black liberation. But Black liberation means liberation for all of us. There's no asterisks on that says only for healthy, non-disabled young folks. That's for all of us. And don't wait for disabled people to reach out to you. Reach out to us. We have so much to offer, our communities. So many, gifts. Our lives are just as valuable. Reach out to us, honor us, value us. We are part of you.
Beautiful. John, so we are down to the last 2 minutes now. I'm going to let you have the honor in doing a wrap-up Any advice to anyone out there, what you recommend?
Well, I think people need to reflect upon how disabled people are so discriminated against in this society, and that to listen to us when we say we love our lives are just as valuable to us as others value their lives, and to set up these death programs so that disabled people can be shepherded to death instead of living is just, it's the worst expression of very deadly ableism. And if people are interested in learning more about the disability response to assisted suicide, I will be participating in a webinar put on by the Patients' Rights Action Fund on September 9th at 4 p.m. And if you're interested, please write info at second-thoughts.org. And that's info at second-thoughts.org. And the word second is written out. And Errol, thank you so much for bringing this subject to light. And viewers may not know that you were once a caregiver for me.
Yes.
And just to thank you for countering so much of the ableism that I carried inside of me.
Yes. Anita, anything you want to say for the last few seconds?
Thank you so much for having me. All means all. And we as disabled people, as Black disabled people, we treasure and value our lives. Hear us, listen to us.
Thank you so much for, thank you. Well, John, Second Thoughts, Anita, Not Dead Yet from Minority Outreach. I want to thank you both for coming on Living in the 21st Century. And to all those who are tuning in, I want to say thank you and have a nice day. Bye-bye.